somebody whose HbA1c levels are high, but when the patient tests his or her blood sugar with a glucose meter and they find that those values are normal, I think to address this discrepancy, we use ambulatory glucose profile. We also use it in situations where patients complain of hypoglycemia, which has never been confirmed, in patients who worry about their glucose levels falling during the night. We also use it to address glycemic fluctuations or variabilities which occur. We also use it to address the effects of certain therapies. For example, subjects on basal bolus insulin, what's happening to their glucose profiles and how we can do better in controlling their blood glucose levels. Ambulatory glucose profile has helped us in ways more than one. An individual single glucometer reading really has very limited information. The HbA1c does not measure glycemic variability. The HbA1c also does not detect hypoglycemia. Finally, the HbA1c is more sensitive to hyperglycemia and less sensitive to hypoglycemia. We can virtually understand what's happening to the patient's physiology. It could be the diet, it could be the exercise, it could be patients taking too much medications, it could be patients missing their medications, it could be a meal activity mismatch sort of situation. So you could liken the blood sugar reading, the blood glucose reading a single time to a selfie, and you could liken the ambulatory glucose profile to a moving selfie. When they see that, they'll say, oh, I didn't know my sugar reports are so fluctuating. So doctor, please go ahead and give me 4 injections or whatever it takes to control sugars. But now the doctor and the patients are at the same goal. Both want to control sugars because they can see the results in a dynamically changing manner. And that's how it has brought value to the lives of patients. This is not a diagnostic test alone. Generate an ambulatory glucose profile report. Make changes in diet, in physical activity, in medicines, and then again see the report, and the patient can see his or her own blood sugars patterns changing. So you are able to see what was happening to you earlier, and you are able to see the immediate results of a therapeutic or a lifestyle-based intervention that you have given. Where blood glucose comes to normal in a good way, then as a patient, the patient understands that his or her chance of developing diabetes-related complications comes down in the long term. It's very important because that is an important tool to convince the patient that this is going to be really useful for them. And when they know that, why wouldn't they go for an ambulatory glucose profile measurement? I'd like to go a step beyond this and say that if a patient is motivated to understand his or her blood glucose levels and is willing to make changes to their lifestyle and willing to make changes in the medication to see that the glucose level is better than before, should we not give that patient a chance to improve his or her sugar levels?